Hello, I'm Dr. Zeytinoglu again. Welcome back to our continuing series about how to take care of yourself with diabetes during the stay-at-home period of the COVID-19 pandemic. I am very pleased today to welcome my colleague and friend, Dr. Celeste Thomas. Dr. Thomas is our lead hospital diabetes physician at the Kovler Diabetes Center. Welcome, Dr. Thomas. How are you doing today?
I'm doing well, thank you. How are you?
I'm doing well, thank you. It's nice to see you. You bring with us a lot of expertise. You've been really sort of at the helm of taking care of our hospital patients with hospitalized patients with diabetes during this time. But first, let's talk about before we get to the hospital. You know, we've talked a lot about how we want to try to keep you out of the hospital, and there's a lot that we can do and are doing to keep our patients out of the hospital. But some of the alarming things that we've been hearing are patients, for example, who've been having heart attacks and really not ignoring their symptoms due to fear of coming to the ER and getting an infection. And so let's talk a little bit about specific things that we should look for that should prompt our patients with diabetes to need to come in to the hospital.
Absolutely. So it's any of those same symptoms that might have brought you to the hospital before. We really need to have that conversation, unless it's an emergency, have that conversation with your doctor or the doctor that's on call, or, you know, that healthcare team to determine whether or not you need to be in the hospital again. Then there are some situations where it's an emergency and family members or friends should be calling emergency medical services, or, you know, unless there's a way to get you urgently to an emergency department. So we think about, you know, shortness of breath. If this is brand new, if you're noticing that you're having trouble breathing, chest pain, and it's important to distinguish that from anxiety and chest tightness. But if it feels like it's been going on for a while and it's not relatively acute, then we would want to call our doctor and find out about it. So if we're having these symptoms, we still need to be seen.
Great, absolutely. And let's go back a step or two. So let's say that, you know, we're sort of in that in-between zone. We're trying to manage at home and see if we can stay out of the hospital. So your blood sugars are a little bit high. They've been in the 200 to 300s or maybe a little bit higher. You're feeling okay, but you're starting to maybe feel a little bit nauseated. What should we be doing at that time?
Right. So this is a time to go ahead and reach out to your healthcare team. So whether it be your primary care doctor or a specialist, whoever you can get in touch with, recognizing that what are my blood glucose goals? Why are my blood sugars a little bit elevated? Do I need to make a change to my diabetes regimen? And then what symptoms should I be looking out for, recognizing that we're at risk for this influenza-like illness? And so, you know, your doctor may ask you to take your temperature, or might ask you some questions about whether or not this nausea may be a presentation of an influenza-like illness. And then being familiar with your medical history, so that you can say, hey, I have this risk factor, I have that risk factor, these are new medications that I've been taking, so that you can get that full history to determine whether or not you're someone who should be tested for COVID-19.
Yes. And let's talk a little bit about ketone monitoring. How have you been advising your patients at home to when should they be monitoring their ketones? And how does that help us?
Right. So when the blood glucose levels are elevated, oftentimes we'll say when it's about over 250, for some patients even, you know, we may give them a higher target depending on the type of diabetes they have and their risk for developing diabetic ketoacidosis, but we'd want them to go ahead and check those ketones. And so what we have been doing is that we're trying to manage mild ketosis, or just a low levels of ketone in the urine. We'd like to be able to manage that at home if you don't have a reason to be in the hospital. And so reaching out to your diabetes team, saying, hey, I just checked, I have, you know, mild ketones or small ketones. I'm concerned about this. And then going through those sick day precautions so that we can talk about, well, you need to take some more insulin. We need to be aggressive with our self-monitoring of blood glucose and repeating those ketones throughout the day.
Thank you. And so we've been trying to recommend ketone strips for our patients. You can get them over the counter. You can get them by prescription. Cost is an issue for some of our patients, of course. And so the Walmart Rely-On ketone strips have been helpful for some as well. So thank you for that advice. Tell us about fluid management before coming to the hospital. What should our patients be doing? Obviously, it's very individualized. And I can't emphasize enough, these are sort of general guidelines, but everybody has to be calling their doctor for specific recommendations. But are there sort of general things that we should be doing to help either before we get to the hospital, or to prevent things from getting really bad, or if we are in that sort of mild state where we're able to sort of curb things at home?
Right, so a lot of things to consider there. So if we think that it's likely that we might need hospitalization, and we know that our patients with diabetes are at higher risk for being hospitalized if we do develop COVID-19, then the best thing to do is to be prepared for that. So, we need to have a list of the medications. And what's really helpful is not just a list of medications, but also the time of day that we took the medication. So if this is a morning med, put that there. If it's an evening or afternoon medication, so that if we do need to be hospitalized, the teams taking care of you know if you've just taken it or if you last took it last night. And then also making sure that you've got kind of a bag with all of your supplies. And so blood glucose monitoring supplies, if you are someone who's using an insulin pump, making sure that you've got all of your insulin pump supplies, so that if you do need to go to the hospital, you want to take everything with you.
Mm-hmm.
And then with regard to fluid management overall, it's important to, stay hydrated, to think about, what you would generally do if you're feeling unwell, which is to rest and have fluids, and that's would continue to be the process. Of course, there are some people who have contraindications who don't need to do that necessarily. And so for our patients who have heart failure and have been given advice regarding that, for our patients who have kidney disease and are requiring renal replacement therapy using hemodialysis. So we've got to, everything is always about talking to your care team, like you suggested, but then we do have these general recommendations, which is always to be prepared. So, first we want to prevent infection. And so I know that you've had some discussions about how do we prevent infection, but then we want to pay attention to how we're feeling, so that if we do need to talk to our doctor, we do that. And we want to be prepared to go to the hospital if that's needed.
I'm really appreciative and glad that you mentioned that. I think, first of all, we're all learning that there are some things that we can carry on with us beyond this pandemic. And I think, being on the hospital side, we always wish our patients, and some already are, thankfully, but sometimes, they come in, they're overwhelmed with illness, and they're not prepared. They didn't know they needed to have all these things. And so having that medication list ready with all their list and the times of day, just like you said, is enormously helpful. This is something that they'll carry forward, hopefully. But I think a new thing that we're thinking of, because of the possibility of having the COVID infection and the way that the hospital is changing, how the nurses are coming in. I think what you and how family members can come in. Oftentimes when our patients who are on insulin pumps come in, and they're not expecting they're going to stay in the hospital, so they don't bring their supplies. And then we have the benefit of calling on a family member or loved one to bring supplies, within a few days. And this may be a little bit of a different scenario where that family member isn't able to come in at this time. And so I really appreciate what you said of being prepared, having a bag ready with, and even if you're changing your site every 3 days, for a couple of site changes, maybe having all of your pump supplies ready to go, having your continuous glucose monitor, even though it's a 10 to 14 days, having 1 to 2 kits available with you is really important. And then for the finger sticks, I think it's really, really important, if you have your own glucose meter, to bring that with you, bring your test strips and your lancets, because this is a really really unique time where you may be needing to monitor on your own in the hospital. Not to put fear in our patients. It's not that the nurses aren't going to be there for you, but this is one thing you can do to engage in your own self-care and help the nurses focus the care on you in another way. And so I think that's really, really important. You've been doing a lot in the hospital these days. And so can you tell us a little bit about what you've been seeing with diabetes care and what our patients have been experiencing when they're in the hospital?
Yes. So one of the things that we are seeing are really dramatic changes in insulin needs, which is why that monitoring of blood glucose is so important. So we see, appetite really being suppressed. I know that we've heard out in the media about a loss of smell and that's certainly having an impact on taste. And so we actually see really significant decreasing blood glucose levels. And with that, we are decreasing insulin dosing. But then, oftentimes there is the introduction, if there's some difficulty breathing, the medication management may then result in an increase in blood glucose. And so what I would say is expect that we're going to be working hard to get the blood glucose levels under control. But with those who have diabetes and this particular viral infection, we're seeing significant variation in the blood glucose levels. And then we're just needing to adjust our therapy to meet those needs. One of the things for a lot of patients, they may be surprised at our target blood glucose levels when you're in the hospital. So at home, we might want you to wake up with a blood glucose level in the 80s or 90s. But when you're in the hospital, because so many things are changing, we kind of change that target. We want it to be slightly higher, probably over 100 milligrams per deciliter, so that we can avoid having low blood glucose levels.
And then even later in the day, I know we like to target a little bit higher than that. Is that right? What do we use later in the day?
Right. So normally if you're at home, depending on your team and your target, we might say that we want you to be less than 130, but really in the hospital, we'll say, less than 180, usually between 140 to 180 is a good target during this time.
Wonderful, wonderful. Well, those are all really helpful, and we really appreciate your expertise. I know you've been doing things sort of at the national level as well. This is a very difficult time, and we really want to protect our patients with diabetes once they get in the hospital. Hopefully we can prevent that. But are there any other pearls that you have? Anything else that we should tell our patients at this time?
I think the biggest thing is to not try to avoid a hospitalization if we need it. So we've got some plans. We're able to take care of our patients. I know that we have wanted patients, to stay at home, but if we need to be in the hospital, we've got to call our team and potentially get there. And we've got people going home. So I know it's really scary. And you'd rather kind of not have that potential outcome, but we know that it's a frightening time, especially for our patients with diabetes. But if you need to be in the hospital, we should get you there and take the best care we can.
I'm really glad that you brought that up, because one of the things that happen that we're finding is that inevitably patients who need to be in the hospital still end up in the hospital. What happens is that they just end up delaying it and they come in sicker, and it's a lot harder to fix things then. And so I really appreciate that you're bringing that up. And also I think as we move further into the pandemic, the hospital systems and the ERs are doing a better job of sort of isolating and sort of separating the patients, so that your risk of getting exposed to COVID, if you don't have it, is decreasing. So thank you so much for highlighting that and for everything that you're doing. I know you're working incredibly hard to take care of our patients, and we're all so grateful for that. Take care of yourself, okay? Thank you so much.
Thank you.